Good morning, everyone. A very warm welcome to all of you join us today for this webinar session. I am truly delighted to have the honor of introducing our distinguished guest speaker, Dr. NBR Srikanth sir. He is BHMS MSc Psychology and also practicing since 20 years. He is student at the Swara Gurukul since 2018, completed TTC in 2022. He is spreading knowledge of the homeopathy under Sankalpana Homeopathy Academy, online education under Shekhar Sir's guidance, and started online homeopathy on Sir's instructions since 2020. In today's session, Sir explains us what is to be observed while treating sick and how to apply Materia Medica clinically. So without further delay, please join me to extending a warm virtual welcome to Dr. Srikanth sir. We are truly honored to have with us. Thank you. Welcome, sir.
Yeah, good morning, everyone. Am I audible?
Yes, sir.
Yeah. So, great regards to all of you. So, thank you for this opportunity. Without further delay, I will enter into the subject. Okay. So, is it okay to share screen? Okay. So, is it visible to all? Hello?
Yes.
Is it okay? Is it visible to all the screen?
Yes, sir.
Yeah. Okay. So, today our topic is what is to be observed while treating sick and how to apply Materia Medica clinical. So before this, actually, what is the plan of today's presentation? So we will go one by one with the idea of a short story to emphasize this observation and the application of Materia Medica. By the story, we will able to understand what exactly we have to be with us in treating the sick and application of Materia Medica. And the second thing is about the Hahnemannian reference with regarding to today's topic, and later with some case examples. So we will start with this story. So in Mahabharata, once a demon king called Maya had approached Arjuna and begged for his life because he had a threat from Indra and Agni. So he got into a crisis. So he approached Arjuna to save his life. Then Arjuna saved his life. So with gratitude, Maya had built, he's a very good sculpture like Viswakarma. Of course, he is on the demon side. The Viswakarma is on the Devata side, angel side. But Maya is a very good sculpture. So with gratitude of saving his life, he constructed a wonderful building and gifted it to Arjuna and along with all the Pandavas. So that building was called Mayasabha. So it is an illusionary world. So what had happened is when that time of Rajasuya Yagam, Duryodhana had approached Pandavas, entered their kingdom, and had an opportunity to see all the things in their kingdom. So he wanted to see Maya Sabha. There is something strange in it. So when he entered into that Sabha, what he knew through it, it is all a illusionary world. What happens is, in this particular hall, everything is like an illusion. So if he finds a wall in it, and if he touches it, there will be no wall. If he sees some pond or tank in the ground side, and when he approaches and to taste or to touch that water, he will not see any water. If he doesn't see any wall, and when he goes along with it, he would be hit by that wall. And if he doesn't see any tank, he use it to fall in that tank or pond. Like so many things are there. There is something here which cannot be seen with the eyes. And when we enter into that thinking that we are good, but we will fail. So what happens is, this is a story symbolically with homeopathic fraternity. Without a proper knowledge of all the tools we have in our homeopathy, as regarding to homeopathy, materia medica, homeopathic organon, repertory, and all the subsequent methods which came newly into the our homeopathic system, we should have a thorough understanding of each and everything. Without this, what had happened to Duryodhana in that court hall, in that hall of Mayasabha, will happen to us. We think that we are doing good and we will fail because of lack of proper knowledge. So, in regarding to this thing, along with this example, what Hahnemann actually said to what actually Hahnemann emphasized all of the homeopathic students to learn is described in this aphorism 3 of Organon. If the physician clearly perceives what is to be cured in diseases, see, he straight away had pointed the homeopathic students to see what is to be cured in a disease. We have to understand who is the sick person. We have to understand how the sickness is exhibited by that particular person. We will see later in examples also. That is to say, in every individual case of disease, knowledge of disease indication. So knowledge of disease. So what he is emphasizing in this particular aphorism is the homeopathic student should have a thorough knowledge of disease. What is to be observed in a sick? This is very, very important for a homeopathic student. What actually I have to see in any given case. If we are well versed with this idea of what actually we have to see, that will become our strength. So, dear friends, please emphasize, please train yourselves in this period of time. Later, it will be more difficult when you enter into the clinical practice. So, you have to seek some mentor or some teacher who train you in this method to observe what is to be actually observed in the sick persons, in the sick people. So this knowledge is very, very important for the homeopathic student to see what actually I have to see in the sick rather than simple collection of data. It doesn't make sense if you are a good data collector. Instead, along with the collection of data, we should able to train our mind and brain to see the important thing that is observed in the sick. And second, he mentions, if he clearly perceives what is curative in medicines. See how beautifully Hahnemann had laid all these things. He has to see, no, perceive. He said actually perceive. You have to perceive that thing. It is not simple seeing. It should be in your every bit of blood. Such training you should give to your mind and brain with regarding to the idea of learning the remedy. So we should perceive what is there that is curative in medicine. Each and every drug remedy in the Materia Medica has some essence. So a homeopathic student should have this idea. He should be well versed with this essence of that particular remedy. That becomes the heart of that remedy. And we will be able to perceive that this is the thing actually that I should know in this remedy. So getting this idea of curative, what is to be perceived or what is curative in a medicine, Hahnemann had emphasized this idea that you should able to learn the remedy individually. You should able to learn the drug's essence instead of studying all the symptoms which are listed in our Materia Medica, different Materia Medicas. We should be able to learn about the essence. That is very, very important with regarding to our understanding of homeopathy. So please, dear friends, feel free whenever you feel difficulty to have any, if you have any doubts, you can make it a note, and we will, at the end of the lecture, we will have a small doubt session so that each and every doubt can be asked by you, and I will try to able to explain your doubts in the later period. So this is the idea. So what further Hahnemann says, that is to say, in each individual's medicine, knowledge of medicinal powers, and if he knows how to adapt. So we have to know about the knowledge of the sick person, knowledge of the disease, what is to be observed in the sick, and next perceive the knowledge of what is curative in medicine. So these two important things, if we know, if we perceive enough, then the third part comes here, which is the adaptation. Clearly basing on, see further sees, according to clearly defined principles. It's not a simple adaptation, simple match the following, but it should be coupled with this art. We should know how to apply. It's not simple match the following A1, B2 like what we learned in our lower grades. It's not like that. It is to be coupled with this art because Hahnemann emphasizes this adaptation should be based on principles. It should be not something like we put in air. No. It should be based on strict principles, on homeopathic principles. The law of similars, the law of dynamics, the law of series of potencies like this. It should be based on some principles. So it should be coupled with artistic way. It should be coupled in an artistic way. And what is curative in medicines? What he has discovered to be undoubtedly morbid in the patient. See how beautiful. Hahnemann is very clear in his understanding and what he wants a homeopathic student to perceive in homeopathy. So he straight away in the first few aphorisms, he emphasized the student to see all these things in the early principles of or aphorisms of Organon. He did not put these things in the last. He is a great genius. So he first emphasized everything, what should be done by a homeopathic aspirant. Then he defined the principles in the later aphorisms. So here also he clearly gave this idea that what he has discovered to be undoubtedly morbid in the patient, morbid, which makes this person something different from other persons, which make this sick patient different from. This is called the individualization. How could one individualize a patient which will be different from all the other patients of the same disease, maybe also? So this art should be developed. This manner of seeing things should be developed. We will explain later in some examples how this thing is to be trained off by us, so that the recovery must ensure to adopt it as well in respect to the suitability of the medicine most appropriate according to its mode of action. So he again says the mode of action before him, the choice of the remedy. The medicine indicated as also in respect to the exact mode of preparation and quantity of required proper dose. All these should be there for a homeopath. The mode of preparation, the quantity of dose, the repetition, everything should be in a proper and the proper period for repeating the dose. So as he said earlier, the foundation, the according to clearly defined principles, the adaptation of what is known in the medicine, perceived in the medicine to the sick should be coupled, should be based on all these principles along with mode of preparation. He should have a thorough knowledge. How much potency should I select? In what way it has to be repeated, on what basis it has to be repeated, and finally he knows the obstacles of recovery in each case. So if we did all this homework and given the medicine also, what is there still in the patient's daily routine, lifestyle, diet, regimen, exercise, etc., that is obstructing the remedy to act upon that human organism? That is also should be known by the homeopath. See how much effort a homeopathic physician should put into a sick person. All these things should be learned by the aspirant of homeopathy. So in the early period, during the study period, where you people are all, this is the golden time for you. Instead of wandering all the other things, put your whole focus, concentration with utmost attention to the homeopathy. Then the future will be all yours. So Hahnemann again says in this thing that in each case and is aware to remove them. So he should clearly able to spot out what is the thing that obstructing the medicine not to act, even though it was well selected, it was repeated, it had given in good doses, in good potency. Still, if the person was not improving, then you can notice, you have to notice, you should notice that where is the obstacle in this person's life that is interacting with the remedy, and you should spotify it, and you should able to make the person understand, and you should be able to know how to remove them by making the person understand the importance of health, hygiene, and the importance of daily routine in regarding to the action of remedy, so that the person will get cured. So that the restoration may be permanent, then the restoration will be permanent. Then he understands how to treat judiciously and rationally, and he is a true practitioner of healing art. So then he will become a true practitioner of healing art. He didn't say a doctor like that thing. So if we want to see ourselves in a healing art with a true idea of true practitioner, then all the above things, all the above principles which were led by Hahnemann regarding this in this aphorism are very much essential to each and every homeopath. Because with these things of about observing what is to be treated in sick, having the knowledge of what is their curative in medicine, thirdly, the adaptation of this clinical knowledge of materia medica to the observation, what we are observing in the sick people. Fourth, basing on strictly based homeopathic principles, a proper dosage, proper repetition, and a ideal understanding of what is there in the patient's life, in the sick person's life, that is obstructing cure, and we have to able to remove it or make the person understand, and thus finally land into the idea of a permanent cure. So all these are the necessities of the homeopathic physician. Okay, so this is the brief introduction of about the topic and the need of the topic at this hour, and what the master had said about this topic, and where he actually emphasized each and every person to learn. So with this knowledge, with this theory part, we will go into the practical understanding, where actually this idea of observing what is to be treated in sick and how to apply the materia medica clinically, or this adaptation, what the Hahnemann said here, we will see in the following examples. So we start with some acute examples so that we will become well versed, and then we will go to the same thing in the chronic examples. Okay, so first case example. Hope you are all understanding about what I actually going to tell. The idea of this practical way of understanding the topic, right? Each and everyone is along with me. Okay, shall I proceed? Yeah, I didn't get any acknowledgement from the crowd. Hope all are with me, at least through the message part. Hello? Hello? Is it okay? Shall I proceed further? So, okay, we will see the first case example. A 2-year-old baby traveling in train for the first time from my hometown to some other place nearby my hometown, Narsipatnam. So while they were about to reach the destination from our local, the loco pilot of the train horned the train. He made a loud horn. So this is for the baby for the first time to travel in a train journey. She never actually traveled in a train journey. So for more than 1 minute, the loco pilot had made a big horn for a 1 minute duration. It was loud and it was with more time than usual time because of some reason. But this affected the child. By the time they got down from the train, mother noticed that the child had fever. So within a matter of half an hour or something, from about to reach the destination, it's a 3 to 4 hours journey. What had happened is the child had got fever. As the mother noticed, the child was suffering with fever around 104 degrees Fahrenheit. So mother was shocked. The child was absolutely free when they boarded the train. But now what had happened after that particular horn? Maybe she was scared and she got fever. And the child didn't complain of anything. Most surprising part is, even though the mother noticed that the child had got fever, it is 104 degrees Fahrenheit. But still, what had happened is the child was absolutely free. She didn't complain of anything. And she says she was fine. No complaints for me. The child was saying, I have no complaints. But mother, when she touched the baby's skin, she found that there is some temperature. Fortunately, they were very precautionary people. So they carried all the medicines with them. And there was a thermometer along with them. So she actually noted the temperature and it was 104. This made her mother more confused. And she immediately called me by phone. So she immediately, as I am very much familiar to those people, so mother immediately called me and she said that the child had got fever. And most confused thing is that she says she was okay. She has fever 104, but she says she was okay. No complaints. But the temperature is 104. On further query, so I asked further, tell a little bit more about this. Then father said that while hearing that loud horn, actually that loud horn part, she started a little bit of fear. She startled actually. ఉలిక్కి పడిందంటే Telugu it is called that thing. And a little bit, then all the complaints, all the problem was started. All the problem is she got fever. So in this case, what is to be observed in this sick child? So any observations in this case, dear friends? Can you type message or can you on your microphone and off your microphone and on your microphone and tell about what are the observations in this particular sick child? Any idea? Do you want to speak? That will be a great help for a speaker if there is something coming from the audience side also. Otherwise, it will be only one way. Any observations? Okay. Though the child was suffering with 104 fever, the child was painless. So she didn't complain of anything. So we can understand that she was what in the text it was called a painless state to the suffering, which appears as a peculiarity in this case. So you all know the remedy. I think the remedy given was opium 1 mg 1 dose. Within 12 hours, the child's temperature got normal. Okay. So what does the text say about this? Let us see. What Kent Materia Medica says. regarding this opium. Among the striking features of opium is a class of complaints marked by painless, inactivity, and torpor. Many of the provers taking small doses had torpor, inability to realize or feel their surroundings, or to take in the nature of states and judge things. Deception in vision, taste, touch, deception of the state he exists in his own realization, a perversion of all the senses with much deception. So here also we can observe the same thing. It is almost a deception. The child is having fever, still she couldn't realize it. She was absolutely painless. She was absolutely in a state she couldn't rationalize that she had some suffering. A kind of deception where the child herself can observe her own realization. What Kent beautifully said about this. In his own realization. See the words from the masters. They had clearly perceived and distributed the knowledge to us. It is our duty to rise to the occasion and grab that fruit of knowledge. So the general characteristic is painlessness, but now and then an alternate state is produced in which a small dose of opium will cause pain. Sleeplessness, inquietude, nervous excitability, the very opposite state from that produced in the majority of cases. Sometimes those sort of cases also we can see, because opium is a narcotic remedy. So the both the states of pain and painlessness are observed in these remedies. So the opposite state is also found, but in majority of cases, we see this painlessness. We see this deception. We see the person is not able to rationalize himself. He is absolutely no idea of what happening to him. Such is his drowsiness, such is his stupor, such is his body condition, such is his experience in mind and body. So opium comes from Papaver family. We have many remedies of Papaver, the morphines, the Argemona mexicana, the chelidonium, the Sanguinaria nitricum, Sanguinaria canadensis, opium, and all these remedies, some or other, has this idea of this Papaver understanding. So the idea here is the absolute painlessness. So the child, instead of having this 104 degrees of fever, she is absolutely painless. Right? In majority of cases, the majority are constipated, but in sometimes there is dysentery and tenesmus. These opposite states prevail in these sort of remedies. Yet at times the drug is characterized by sleepless nights, anxiety, increased sensitiveness, noise, so that he says he can almost hear the flies walking on the wall and hear the clock striking in the distant steeple. So sometimes these sort of high nervous excitability is also seen, is also observed in rare cases where opium is going to be indicated. But in most cases, what actually we see that these people are absolutely painless, inactivity, and torpor. These are the marked things in this remedy. So here, when we closely understand these two things, what is the observation in sick and what is we got curative in the medicine. So the temperature of 104 degrees and still child is active and without any complaints is what we observed in this sick child. And the fright had caused all the problems. We know that opium is one of the high ranked remedy with the ailments from fright. There are other remedies. There is aconite, there is opium, there is arsenic album, there is gelsemium. So each and every remedy which has this understanding of ailments from fright, when we have this particular origin, still we have to make a hunt about the quality of this fright. What's the person's experience with regarding to what has happened with that ailment? So simply taking that ailment from fear doesn't help us to select the remedy. We should make us understand what actually triggered. So we should make a holistic survey about that fright thing, but should not take simply the ailments from fear. It will not help. What had caused the fright and how did this person's respond to that particular ailment, to that particular causation? It is also should be studied. And when we study, we will may able to notice what is a aconite fear, what is a stramonium fear, what is a opium fear, what is a gelsemium fear. Like this, we can able to understand each and every remedy's fear part, rather than simply taking a note that fright had caused the problem and going to repertorize. It should not be done in a manual way, but it should be done in an artistic way. That art should be learned by the homeopath. So from Kent Materia Medica, what actually had is there in this curative medicine? The fear and its results. There is also a sensation of bodily well-being and happy, great state of confidence in the first hour. Hence, complaints from sudden joy, anger, shame, fright. This is what actually there in Kent Materia Medica. So with this, we can clearly understand what is to be observed in sick person and how, what is their curative in the medicine and how to adopt this knowledge of materia medica to that sick person. This is an idealistic example. If we had a good knowledge of this thing, this is an ideal example to begin with, to have a thorough knowledge of materia medica, good observation of sick and applicating this materia medica knowledge to the sick person. Traveling further, we will go into the second case. A male child aged about 10 years with temperature of 103 degrees Fahrenheit came to clinic. The child appeared very drowsy and the mother has to carry the child. He was so weak and drowsy and he can be hardly aroused. On query further, father revealed that they went to trip somewhere to the countryside, and on returning from the trip, the child got sick and had cold, cough and fever. Slowly the fever got increased in one day and led to this condition of severe stupor, drowsy, child cannot able to realize the things going around her, etc. On further query, it was revealed the child did not pass urine since morning and mouth was very offensive, what the parents told to me. When I asked his name about the child, the baby name, he said the child just looked at me in a confused countenance, with a confused countenance, and returned to the stupor again like this. He just looked at me like this, again got into some sort of stupor, and he didn't answer the question. So such is the state of stupor. So, what are the observations noticed in the above case? Any observations from audience point? Anybody wants to share something? Okay. So, here are the observations here. The speed of the disease is very fast. It started with some mild acute cold, cough, fever, and it went high immediately. The speed is very fast and indicated that there is some sepsis inside. So all these septic conditions, though no matter what the disease is, it may be called some virus disease, it may be called some bacterial disease, it may be called some fungal disease, it may be caused by any of the microscopic fellows, bacteria, virus, fungi, anything. We should able to understand the speed of the disease. It will help us. Then we should able to search the same thing, the same pace, the same velocity from the materia medica. And when we study the materia medica, the drugs in materia medica, we were able to understand the pace and velocity. Look at the pace and velocity of bryonia. Look at the pace and velocity of roostox. Look at the pace and velocity of belladonna. Look at the velocity of aconite. You can clearly able to understand and get palpate the pulse of the remedy. If you read them thoroughly, if you able to see some cases sitting beside your mentor, you can clearly able how he can able to palpate that cases velocity and pace. We have some set of remedies from the materia medica with this same state of proceeding into sepsis. It indicates some zymotic state. The lachesis, ailanthus, the baptisia, the pyroxenum, all these remedies, high sepsis and zymotic state prevail in them. And when we study the materia medica, we can able to clearly notice that these are drugs with something different perspective. Like this, in this case observation, as soon as the child returned from the trip, he drank some water, he ate some food there, everything was mess in that particular region, in that countryside. So as soon as he got from that thing, immediately he caught with some cold, cough, throat pain, fever, etc. And the fever was so fatal within a matter of hours. The child appears very besotted, a confused state, not able to understand, not able to rationalize the surroundings. And the excretions were diminished. There is halitosis, the idea of offensive order from the mouth. So with these picture, these totality, I administered 1 dose of baptisia 1 m to that particular child, and immediately he got better within a span of 12 to 15 hours. The temperature got reduced, and by 1 day, the temperature got normal absolutely, and the child was playing like anything. So what are the observations, what the master had said about this drug in his Materia Medica? Let us understand this. Baptisia is suitable for acute diseases. It is principally a short-acting medicine suitable for complaints that are not long-lasting. So far as we know, it is not an antisoric, does not go deep into the life. All of its acute diseases and complaints have the appearance of zymosis, like scarlet fever, diphtheria, typhoid, gangrenous complaints. There is one thing that is unusual about it. it brings on the septic state more rapidly than most other remedies. So this is what we observed in that boy also. It brought that state, it brought that sepsis, it brought that zymotic continence, it brought that halitosis, it brought that excretions got diminished. Everything is turning into a septic state, and it was very fast. Like arsenicum, phosphorus, ruse, and bryon, all these remedies may have that state, but the pace is very slow for those remedies. And here, what should have happened after 4 or 5 days was happening within 1 day. Such is the speed of baptisia. When an individual comes down suddenly from cold, from malaria, from drinking poisonous waters, and from any zymotic or septic causes, he is hurled into bed in a few days instead of going through a period of 4, 5, or 6 weeks. The old idiopathic typhoid fevers come on slower. Baptisia is suitable for those blood poisoning that are highly septic, not that come in a lingering way. That's not where the baptisia's bread and butter is. Baptisia's bread and butter is here, where everything turns into sepsis and zymosis with no matter of time. It's so high pace, high velocity. But all at once it turns into continued and takes on septic symptoms. See how clearly Kent emphasizes. If we study Kent, we will able to portray a person like that. That's the beauty of Kent Materia Medica. There are many other Materia Medicas. Definitely all are worthwhile. But Kent had beautifully described in such a way that you can personify that person in front of you. You can imagine, you can draw a picture. It is more like an artistic way of presentation, the Kent Materia Medica. So here, so much for its progress and its pace. Every medicine must be observed to its velocity. That's what I said. To its pace, to its periodicity, to its motion, and its wave. So every wave, the pattern of that particular. So we start observing with velocity, pace, and finally we land in the idea of the pattern of that particular, the energy of that particular remedy, the experience of that particular remedy. So Kent had laid a foundation about the future sensation understanding of that particular remedy. The wave idea, we get that by looking at the symptoms. You take an individual who has been down in a mine, in the swamp, down in the mud, in the sewers, who had inhaled foul gases, who goes into bed with a sort of stupor. From the very beginning, he feels stupid. It is not gradual. It is not gradual in that remedy. Everything is so fast. So there is no need that a person of baptisia should dig into the mud or should jump into some sewage like this thing. Kent makes us to understand such is the way we contact diseases, where some septic things from the environment and the susceptibility comes into play and the individual catches that particular disease. That's what Kent emphasizes. It need not should be the same example. So a doubt may arise that in this case, the boy didn't went into any mud, into any sewage, still he got that. It's not about necessarily the same manner, but we should understand the velocity and the pace. The causation may differ with respective to the time duration to then particular condition and to now. There may be a difference in the causations, but we should understand the manner in which the disease would progress, the velocity, the pace, the wave, the periodicity, the motion. All these criteria are these physical dimensions of that particular remedy should be understood, and at the same time in the disease, in the sick people, we should able to observe all these entities which are whirling in that particular sick child. It is not gradual, but he goes down very suddenly and he is stupid. He is prostrated. His face is mottled. Swords begin to appear on the teeth much. So that's what Kent gives in his Materia, right? So with these two case examples, I think most of the people had got this central understanding of what Kent had emphasized, that what is to be observed in the sick, what is their curative in medicine, and the adaptation of this knowledge of Materia Medica clinically to the sick person. So we will go with the third case, the acute case. It is also an acute case. So it is much in my early days of practice, within one and a half year of my practice started. One summer evening, 6 months baby consulted with vomitings. So at around 6, 7 in the evening, they consulted me. There were 6 to 7 episodes of vomiting in a span of 3 hours. And the mother was horrified because the child, the baby, was very weak. She couldn't rise up and she went into absolute dehydration. So mother was very confused. On inquiry, it was found that the baby was taken to shopping mall, nearby mall or shopping shop in the hot summer, in the afternoon, very hot, middle of summer. So in our area, it usually be 40, 45 like that in the midsummer. And during that sick time, this 6-month baby was taken by mother outside, which is a foolish thing actually. Also, the baby vomited, and after vomiting, the baby went asleep. So that resulted in this condition in the evening. So the causation was happened in the afternoon session, and as soon as they returned from the mall, all the picture was started. So in the consultation time also, 10 to 15 minutes after, the baby roused up again, cried loudly, and parents were worried about the feeding, and they fed that baby with some milk. And the baby drank milk very quickly, as if she was in hunger, and speedily. And in a few minutes, there was a vomiting with curdled milk. So the child is sick in hot summer. So what are the observations? Anybody want to say observations? Okay. The child is sick in hot summer. First thing is, the child was sick in hot summer, and the baby looks like severe exhaustion. The baby was in severe exhaustion. The child was craving for milk and suckling milk very fast, and as soon as after vomiting, the child went into a sleep with severe exhaustion. And as soon as the baby woke up again, the baby was crying for milk. Crying for milk or not, we don't know. The baby was crying, and the parents are feeding the baby with milk as thinking that the baby was in hunger. And again, the baby vomits all the milk, partly with curdled and partly milk. Ethusa synapium was the drug given 3 doses. After every spell of vomiting, I asked the mother to give one more dose. So the same cycle was repeated for 3 times. After first dose, 2 times. Then entire process was stopped. No further vomitings, no further exhaustion, and no further crying. So this is another beautiful case of what actually, observe the thing, the exhaustion part, the hot summer, the midsummer causation, the cycle of crying, feeding, vomiting, sleeping. See these things. Make a clear picture. Draw a picture in your mind. What was happening with that sick child? Take them together and build a picture of that sick person. After doing this, hunt for the remedy in the Materia medica which suits the similar picture with that speediness of case, with that hot summer ailments, with that exhaustion part, with that vomiting part, with that sleepiness part, all these things. This is very, very important for a homeopathic student, right? So what Kent says in this drug is, I think we missed here the slide, but what Kent says has clearly picturized this thing in Ethusa synapium case. In the text, in the Materia medica, he clearly emphasized the importance of feeding the baby. He's a good instructor of how to feed the baby. Maintain that gap of around 2 to 2.5 hours. Don't feed the baby as early as you are, thinking that the baby is crying only for milk. That shouldn't be done. Kent clearly had given, please read Materia medica of Ethusa from Kent Materia medica, along with this vomiting and diarrhea part, which may happen in these hot summers, or which may happen in cholera infantum, which may happen any disease you name. With this idea, with this background picture, if you do that, then you can clearly able to understand the heart of the Ethusa synapium drug, and you can able to find or adopt the same knowledge to the sick person. So we will go with the first chronic case. If you are well thorough with the acute cases, we will go with the chronic case. So hope all of you are with me, right? Okay. So we start with the chronic case. An elderly man aged about 60 years came with the complaints of rheumatism of both knees. So I took the whole case carefully, but here now I am giving only the crux because of time scarcity. He is a retired teacher and said he stopped going out completely and tend to sit in the balcony all the day of his apartment. This seems to be quite interesting. He said that after retiring, he is not able and not want to also go out and have a wander in the streets or just move out. Instead, he wants to sit all day in that apartment, in the flat, in the balcony where no one comes near him. And so I picked up that point and I asked, what's the need to sit in the balcony all the time? He replied that his grandchildren will play different types of games. So he is residing along with his son and grandchildren. So both son and daughter-in-law are working. So his wife will look after the kids, but this guy sits in the balcony where no one comes near him, and he is away from that grandchildren because they will play different types of games in other rooms, and he had a fear that something may hit him while they were playing some games, so that ball or some such sort of things, material things may come and hit him. So he prefers to stay in the balcony of that flat, of that apartment, where no one comes near him and no things also come near. Right? So the observations here. So what are the observations here? So there is rheumatism of the joints. There is soreness, muscular soreness all over the body. And there is a fear and anxiety that something may hit him. He is a touchy person, doesn't contact, morose, doesn't want to contact, doesn't want to socialize. And even the pains also are worse by touch. So what is the remedy you thought of? Any guesses from the audience side? Okay. So the remedy given was Arnica 30. Once in 15 days for 3 months. We had given this Arnica 30 because we will study from the master how that matching had happened, how the adaptation went with the idea of perceiving what is there in curative in medicine and about the knowledge of the sick person. We understood the knowledge of sick, and clearly we will understand when we read from Kent what is there that suited the adaptation. Then we gave Arnica 200 once in a month for 3 months. And finally, we Arnica 1M after 1 year. And this patient was completely cured. He is absolutely fine, even now also. So he sometimes meet me in the market. So, dear doctor, you done this to me 10 years back, and now I am absolutely fine with no joint pains. Now he was, I think, around 70. Still he is able to walk, comes to buy the vegetables, etc. Doesn't sit in the balcony. Instead, he play with the grandchildren. Now they are also got older. But that is the way the person was improved chronically. Right? So now, and the fears and anxieties also went away. So now I understand what Kent emphasized us to learn about this remedy. So we will study from Kent Materia Medica. Please closely watch. The Arnica patient is morose, wants to be let alone, doesn't want to be talked to, doesn't want to be approached. He doesn't want to be approached both because he doesn't want to enter into conversation, a mental state, and also because he doesn't wish to be touched on account of the great bodily soreness. So both physically and mentally, the Arnica person is touchy, very, very touchy. You see the Arnica people, the chronic Arnica patients, they never wants to be mingled. They never wants to socialize. They wants to stay aloof. They wants to stay alone. Such is the, and they have great fear and anxiety. Some Arnica fellows has this idea of that they feel pride about their disease also. The chronic Arnica patients had a delusion of that he had some heart disease. And there is no one on the planet Earth that they could find the disease. If you suspect that this guy is from Arnica, never say that you are okay. He will definitely doesn't trust the credibility of the doctor. He will come out and say, this doctor says no, nothing. Such will be the Arnica. The mistrust expands in the chronicity of case. So when the need is for higher potencies of Arnica, the delusion is more deeper, more harder to break. And we need higher potencies to enter into such cases. So, okay. This is the latter part. These are the two most striking things in this medicine. Irritable, morose, sad, fearful, easily frightened, imagines all sorts of things. That's what I am emphasizing upon previously. Especially that he has heart disease. See the beauty. He will definitely at one point of time begin to imagine that he has some sort of heart disease, and if you say that you are okay to him, he will not trust you. That is the peculiarity in arnica. You should say that there is something problem with pulse and the heartbeat is something different. If you say like these of things, then arnica will build a trust upon doctor. Yes, this doctor knows something. But if you try to console him by saying that you are okay, definitely this arnica patient will leave you. You are going to lose that patient. If you suspect that this person may be going into arnica, don't console those persons. Okay? Heart disease, or that he will mortify, or that some deep-seated trouble is upon him, full of nightmares, dreadful dreams, dreams of muddy water, robbers, horrors in the night. He frequently rouses up in the night, grasps at the heart. He says something that is problem with the heart. The appearance of great horror, fears some dreadful thing will happen. So if he is away, he calls the other persons in the night, saying that he had something with it. Come quickly, I am down with the heart disease. And the people, the son, daughters, etc., who may living nearby, or the friends, or the relatives, rush up to him in the midnight and see, and he is perfectly okay sitting like this. So these things will repeat. If he is an arnica patient, this thing will repeat. He frequently calls them, come, I am down with some heart disease, something is happening to me. And when people approach him, he is quite all right. These things will repeat. Okay? He is full of dreadful anguish. But finally, he comes to himself, lies down, and goes off into sleep of terror. Jumps up again with the fear of sudden death and says, send for a doctor at once. That's I said to you. This is repeated night after night in persons who are fairly well in the daytime. During the daytime, these people are fairly well. Who will have to sympathy because there seems to be no reality in their sickness. Say, everything is a delusion here. No reality, no real sickness, no heart, no mitral valve theory, no left ventricular hypertrophy, no such sort of things. Still the person personifies all the symptoms of some cardiac evaluation. Repeated ECGs, repeated echoes, this sort of record you will see. It also seems in persons who have gone through a railroad accident or through some shock, who are sore and bruised from that injury. Such state may come from such sort of things also. And they come with sudden death, with an expression of terror. The horror they really went through or repeated this is similar to opium, but the opium fear remains even in the daytime. Arnica dreams of it. For opium, for fear, there is no day and night, no periodicity. But arnica, all these things happen in the night. In the daytime, he is okay. Because of light, something is there. So he has some confidence. And all these things crop up in the night. So the same thing, arnica is useful in some chronic cases. In gout, it is quite a common thing for old gout cases with great sensitiveness. You will see the old grandfather, exact picture of what Kent said here. Please look at this. Sits in the corner of the room. Only thing is he sits in not in corner but in balcony. And if he sees little Johnny running towards him, he will say, oh, do keep away, don't come near him. Give him a dose of arnica and he will let Johnny run all over him. He does not want to be touched or approached. Life feels that anything is coming towards him, he is going to hurt him. He is extremely sensitive. His joints are sore and tender, and he is afraid they will hurt. So, that is the picture in the arnica. That is to be perceived in the arnica according to the Kent. Moving on to the chronic case 2. So here, an elderly man aged about 50 years came to clinic wearing the jacket in the hot weather. These things are also very important. What a person will wear during an interview. Not only what he says, but the manner in which the symptoms were told plays a crucial role in some cases, like this case. A chronic diabetes patient came with an ulcer on his right leg. I took the whole case, but here we have no time to portray the things. So the pivotal points only I am mentioning here. He asked me many questions regarding his health condition. So always it's a doctor, is it curable? Sir, how many cases did you cure with the diabetes ulcer? Any idea? So these cases are going to be into gangrene. So at this age, do you think that varicosity may accompany the diabetes? So many doubts, and the doubts are more towards his death condition. So what is the average life of a diabetic patient? My grandfather lived for 90 years. My father was healthy to 70. Why, doctor, I am now 40, 50, and I have so many complications. Is I am going to die a little bit younger? Like such sort of questions, so many questions during the interview. The prognosis of this ulcer, regarding the prognosis of ulcer also. He mentioned many times during the conversation about the life period of diabetic patients. He was very meticulous in keeping his record files. I was really surprised. For about 10 years, he was suffering from diabetes, and every note or every clinical investigation was so neatly and tidily packed in that file in a chronological order from down to up. So even because when we see the first page, that is a recent one. Like that they were placed. The 10-year-old report was at the bottom. So that he said that it is able. So I asked him, why did you keep like that? Why didn't you keep like that? So he said it is easier to refer, because nowadays, if you put the upfront, the investigations in recent times, then it will be able to clearly emphasize for you to pick up how the diabetes was going on from the past few years. How are the values? So that is his reply. He was very meticulous with his records, files kept in a sequential order for almost 12 years. Every paper was neat. It was not turned, torn, nothing. Neat, clean, tidy, placed in a chronological order. Patient complained about burning in that ulcer area. The pain associated with that ulcer was of burning type. So the observations, asking many questions, shows his fear and anxiety, maintaining and arranging investigations very neat and clean, fastidious nature, that is what we call fastidious, burning pains in ulcer, and wearing a jacket in the hot climate, a type of chilly idea. So any guess from the audience side, dear friends? Any guess of about this remedy? Anybody want to share their thing? Okay. Nobody wants to share anything. Right. So,
Arsenic.
pardon, ma'am? Pardon?
Arsal.
Yeah, very good. Very good. Very nice. So, it was arsenic album. Very nice. So, arsenic album 200. One dose. So, here the remedy was repeated weekly for 1 month because of his pathology in the leg, the diabetes accompanying that pathology. So here what the dosage should be in such a way that it should gel with the pathology of that remedy also. Otherwise, we will get into crisis. Waiting too long, we may lose persons in some pathological cases. So here, arsenic album 200, one dose weekly was given for 1 month. And the ulcer was completely healed. So I didn't have the pictures, unfortunately, because at that time I'm not so focused on such sort of things. But these days I'm keeping now. The ulcer was completely healed and his diabetic values were also under control. That is so surprising. Previously, however, carefully is all the way very careful person because of his remedy also, very meticulous, will not eat anything, no sweets, regular diet, exercise, meditation, yoga, everything. But still, he couldn't find a solution to the diabetic values. They make him worse. So after arsenic, not only the ulcer was gone, but surprisingly, the diabetic values were also under control. Right? So we will go with the master's understanding. Fear is a strong element in the mental state. Fear to be alone. Fear something is going to injure when he is alone. Full of horror. He dreads of solitude and wants company because in company he can talk and put off the fear. So the idea of asking too many questions or conversing more to the with the doctor is also to get rid of this alone state, to get rid of this thing, to have some sort of conversation that will make him happy, that will make him come out of that fear even for that short period of time. That is the concept behind. He dreads solitude, wants company, because in company he can talk and put off the fear. But as this insanity increases, he fails to appreciate company. But when the chronic diseases extends, stretches beyond the saturation point, what happens to these arsenic people? They will begin to hate the company. They prefer to be alone, but it happens at the more later stages, most later stages. And the fear comes in spite. So the fear dominates. He has a violent increase of his fear and horror in the dark, and many complaints come on in the evening as darkness is coming on. Like what we studied earlier, Arnica people, same like that person. The darkness will bring all the fear and anxieties here also. But Arnica has this idea of this aggravation throughout the night. But usually arsenic has this aggravation between 12 to 2. The modality, even the fevers of arsenic usually start at this time. At this 12 to 2 period aggravation, the fever suddenly comes up. The aggravation may not be of what the person actually had. It may also refer to this thing that the commencement may also, the starting point may also be in that periodicity. So what is the other remedy which has aggravation at night? Any idea? Somebody want to share any other remedy which has a characteristic aggravation at night? Many remedies has, but the fevers, the ear pains, the colds, everything, the urinary symptoms, the gastric symptoms, stomach, everything was aggravated in night. Anybody wants to come out with any remedy? No? Okay. So other remedy which has a fantastic suitability to this night aggravation is mercury, the mercsol, and all the mercury compounds are salts. The mercur, the mercinatus, the mercidatus rubrum, mercidatus flavus, mercdulcis, all these remedies has a fantastic suitability to this night aggravation. Ear pains, the baby is calm all the day, it got cold, the parent had given some cold drops, the nose block was okay. In the night, suddenly the child rouses up, cries like anything. Oh, I'm getting ear pain. Oh, I'm getting ear pain. So the person comes in the morning with the child. Yesterday, it was a hell for me as my child had caught some ear pain in the night. Now, how is it now? Now it is okay. How is it yesterday morning? It is okay. But in night, and if you didn't give Merxal, you had got with any other remedy, the same scenario continues in the next night also. And the third day, you have to give mercury. So again, as I said earlier, palpate the sickness, make able to pulse what is to be observed in the sick. That is the most important thing of any homeopathic aspirant. You have to be thorough with the sick knowledge. You have to be thorough with the remedy knowledge. And the third thing, you have to make it a habit to adopt what is there you perceived in the clinical aspect of that materia medica remedy to the what you had observed in the sick patient. These things should be taught of. These things should be cultivated. These things should be practiced. These things should be well versed with a homeopath. And the aspirant needs to dwell into it. It is not simple learning. It should be a dwelling. It should be enter into each and every bit of blood of your body. These things that will incorporate you into a deeper aspects of homeopathy. So there, one of my teachers used to say a rule in homeopathy. He said, homeopathy is like an Newton's third law. For every action, there is an equal and opposite reaction. The moment you embrace homeopathy firmly, strongly, lovingly, hardly, deeply, the homeopathy in turn embraces you with the same velocity, same acceleration, same magnitude, same strength, same volume. But it should be done from your side. So, dear friends, please make a habit of thinking nothing but homeopathy, especially in these early days. Okay, so we will continue with what Kent had emphasized. Full of horror, dread solitude, because in company he can talk and put on the fear. That's what, put off the fear. That's what I said. Actually, the mode of talking is he is releasing his anxiety in that manner. He fails to appreciate company in the latter part, and dark, and any complaints come on in the evening as darkness coming. Many of the mental troubles as well as the physical troubles come on and are increased at certain times. While some complaints, pains and aches are worse in the morning, but most of the sufferings of arsenic patients are worse from the 12 to 1 to 2 p.m. and from 1 to 2 a.m. or in the midnight or in the morning. But usually it will be in night. Very soon after midnight, sometimes his sufferings begin. That's what I said. It's not only what he had that are aggravated, but also they are that time actually may be the commencement or the maybe the beginning of the disease. So aggravation need not to be that these modalities will aggravate at that period. Don't think like that. It may be beginning also. To clinic, they are intensified. Extreme anxiety in the evening in the bed. So there is extreme anxiety, fear, fear, fear. The old text says that arsenic album are gold cane headed patients. It was written in Kent Medica. So when arsenic album sits nearby you and the wall in front of that patient, if the time due to some reason was stopped tickling, the clock was not tickling. So he will be in so much restless. He sits like this, like this, like this for 5 to 10 minutes. Then he will rise up and immediately go up, take a stool, will climb on that stool, take the clock into hand, and he will correct the time and keep the clock there, and they will get down from the stool. So such will be the anxiety or the fastidious nature of arsenic album. So even if he is so much worried about something happening in the doctor's chamber, he will suggest you, doctor, I think your books are little bit older. So you make them arrange in such a way that the arrangement should be from smaller to bigger or bigger to smaller. He couldn't resist that thing. He is so fastidious. Or some, if he is more arsenic, he will get up from chair. He will himself will put that books in a neat and orderly manner from big to small. If your rack was with books not arranged in that manner, in an orderly manner, that things will hurt arsenic mind in chronic state, mostly in coped up state. You can clearly identify arsenic album there. So dear friends, emphasize, study from that perspective. Homeopathy will be a beautiful art. If you truly love homeopathy, what happens is you cannot resist to speak it with other people. So most of my friends, juniors, always complain me about this only. You know what? Everybody, you will not talk about any movie, politics, anything. Every day you talk about the same thing. Such is the taste of homeopathy. You cannot put it aside if you really taste the sweetness, the essence of that particular fruit, the divine fruit homeopathy, right? Okay, we will go with the third example, the last of the section. Okay, hope you are all with me. You have a good journey of 5 cases, and this is the last case. One fine morning, one of my patients had turned up and asked me whether I can pay an house visit to solve an insanity case. I said, okay, and asked her to give a complete information of that particular patient whom I am going to pay a visit. So she had given the following details. So this guy whom I am going to see was aged about 45, suffering from severe neurological problem since birth. So he has some birth issues straight away from birth. And the milestones were delayed for this guy. The talk was also a little bit awkward. It's not like normal people. And he had a history of convulsions. And he was treated with allopathy. Still, he was using the same remedies. And now from the past 3 years, the scene was a little bit different. So he became more violent from the past 3 years. So violent that they have to tie him with some chains and ropes. He yells, shouts, and sometimes beats when somebody approaches him, even mother also. All the efforts from the allopathic standpoint were in vain, as the relative said to me. So she tried to explain this guy about this guy in whatever language possible. So to make me understand that the situation is very much violent. So I'm going to face a dreadful person. So she clearly emphasized me about this. So I then, with all this information, I paid a house visit. So when I reached the home and I entered into the rooms which was nearby to that room, I saw him. He was separately in another room, and he was tied with some rope, because to cut down his violence, so the people of the relatives used to tie him to some wall like these things. And he is so strong also. Sometimes he pulls that rope also. And the pillows were bitten. Yeah. So whenever he was tied, sometimes he pulls that ropes. He became so violent. He bites the wood. He bites the pillows, snatches the pillows, puts the pillow things all over his. So that is the picture when I actually saw the patient. And I observed some teeth marks on the wood chairs. Wood chairs has teeth marks in that room. So imagine the situation of me. Okay. I was also a little bit scary. So what is going to happen? So the observations, the patient was very violent and nobody could approach him. They are giving that food through the window. During these 1 or 2 days when I paid a visit, they are simply throwing something from the window. And he will not tell about the urine, stool, etc. But there are some times where the period of insanity was not there. So some hours he is okay. It is not completely in that thing, day and night. There are periods. It is a periodical drama here, where he will get so much high impulses to cut, tear, destroy the things around him, beat the persons around him, bite, beat, etc. But when there is this period of not having insanity, they will call something as lucid interval. He appears very frightened. Like this, he will use it to sit. What the mother said. So he will take the head between the hands, doesn't want to show his face or that, as if he got frightened with some object or some person or some demon, etc. He simply, that is happens during the lucid interval, and doesn't want to converse. Even that period also, he doesn't want to converse with anyone, but he was okay with mother, and keep his head in between his hands as if there is some severe headache or something like this. So this is another observation. When I approached there, I got this thing. So what are the observations here? Patient was highly restless. So first thing we observed is a severe restless state, severe violent state, frightened appearance. There is this idea of cursing, tearing, biting, and wild look in eyes. His eyes are wild. During the frightened state, they look frighty, as if something frightened it. And during the opposite state, they are frightened, like this, high opening the. Keeps his head between hands. So he keeps on head between hands. So this is the picture given by the mother. So what is the remedy you think of? Dear friends, as this is the last case, I hope some of you can come up and share your ideas with regarding to the remedy. Any idea? Pardon? Couldn't hear that. There is some signal problem, I think.
Maybe confused between belladonna and hyacinth.
Belladonna, hyacinthus, very good. There is another sister of those two. What is that? What is the sister? Pardon? What is stramonium? Very good. Excellent. Very good. Very good. Stramonium 30. Very good. Thank you, dear friend. Stramonium 30, one dose was given and the patient was very much better. All the violence was gone. Patient was normal. He used to take his food and sleep normally. Became social. Everything well for 6 months. So stramonium 30, even to my surprise, this is one of my classical cases in my early practice, where so many patients from that vicinity had approached me after this case, seeing the result. Stramonium 30 was helped this person superly, and he was okay for 6 months. And after 6 months, the same scenario was repeated. Again, he got into this thing. So I was called again and I paid visit. Everything is same what I experienced previously from the last couple of days. So this time I increased the potency and gave stramonium 200, followed by very good improvement. Again, everything got diluted. Everything was okay for another 6 months. Then they stopped coming to me. So they thought that why should we pay fees? Maybe. So they doesn't want to continue even that placebo also, which I am giving them. So they stopped coming to me after 1 year of starting the treatment. First with 30 and then with 200. After 1 year, out of my interest, so I had this peculiarity. or you can call it as a foolishness also. If the person doesn't turn up, I had this habit of calling them. So what had happened to you? Because out of my interest, what I had given to them, I want to make a note whether I had made any error, so that I will develop, I will correct my mistakes. So this is my habit. So they stopped coming. So after looking for another 3-4 months, or I don't remember the exact time and date. So I made a call to them. And out of my interest, I called the lady actually who had approached me at first, the relative of this particular patient, and got to know that after 1 year, the same scenario was repeated. So again, after 200, the same scenario was repeated. And this time, instead of these people approaching me, they thought that this is coming back after with homeopathy again and again. So allopathy will do a little bit better. So they took him to an allopathic hospital and had given some injections. And soon after the injection, the patient was collapsed and went into some sort of coma. For 3 to 4 months, I think, for 3 to 4 days, if I remember correctly, he was in coma, and finally the undertaker had taken him away after that period of 4 days. So it was very unfortunate, but still I laid this case to make you all know such sort of practical problems also will be there in homeopathy. So people are so misled by the community, by the environment, by the people around them, or some advertisement, etc. And they may make any errors, and it is our duty sometimes to again get back them to the road if they are willing to ride on the road back. If they are doesn't want to come, it is different. So this may happen. So here Stramonium did so much wonder. So what the master had said about Kent had said about this Stramonium, we will see. So let us read from the Kent. When considering Stramonium, the idea of violence comes into mind. See the violence here. One cannot look upon a patient who needs Stramonium or who has been poisoned with it without wondering at the tremendous turmoil. See the turmoil happening here. The great upheaval taking place in the mind and body, full of excitement, rage, everything is tumultuous, violent. The face looks wild, anxious, fearful. The eyes are fixed on a certain object. Face is flushed, hot, raging fever, with hot head and cold extremities, violent delirium. In his anxiety, he often turns away from the light, wants it dark, is aggravated, especially if the light is bright. High fever with delirium. Heat is so intense that it may be mistaken for bell, but it is usually a continued fever, only at times remittent, while the intense fever of belladonna is always remittent. Stramonium is like an earthquake in its violence. The mind is an uproar, cursing, tearing the clothes, violent speech, frenzy, erotomania, exposing of the person, and these symptoms are found in continued fevers or insanity or cerebral congestion, or it is useful also in violent typhoids. So the disease may be of any sort. It may be some congestion, or it may be some tuberculosis, or it may be some other thing, or it may be of insanity, or it may be simple viral fever. Don't run about the diagnosis part, but understand the idea of the observation. What actually we have to see in these sort of cases. Habituate to see them. Habituate to see the idea of studying the sick person holistically, the holism part, rather than simple rubrics or simple symptoms, simple modalities. Don't run. As Kent says it earlier also, study the wave pattern, study the pattern of that sick person and study the pattern of that particular remedy. And now adopt this pattern to that sick person. That is the beauty of homeopathy. It is useful in mania that had existed for some time. Attacks of mania coming on in paroxysm. That's what happened in this case. It's a maniac case. Paroxysms. There is some lucid interval, appearing with more or less suddenness, so that a single attack would look like belladonna. But the history differentiates. Belladonna would be more than a palliative in the first attack. Maybe in some initial times, belladonna will help and later be followed by stramonium in such sort of cases. But when you study the depth, the violence, the horror, the earthquake, the darkness theme, then you can understand and you can pulse stramonium in that case. And you can freely give stramonium when you understand the speediness, the pace, the velocity of the stramonium. But in initial days of practice, sometimes it's happened that we may mistake and we may give similar remedies of what exactly the simillimum should be thought of. So rather we will give the similar remedies. That is not an error. That will happen in the initial days. Don't worry about it. Then make a note that in these cases, first some remedy was actually helped and later the simillimum helped, and try to establish a connection between these two remedies. That's what Kent says in his lesser writings, that every homeopath should have his own materia medica, his own repertory, his own accomplishments, his own experience, and he has to maintain that record. Because homeopathy itself is a big ocean, right? So try to understand this part more clearly. Okay? And the second exhibition of it would do nothing. So when in such similar cases, when we had given similar remedy, it will help some in first phase, but later we find it is of no help. Then we can understand that stramonium is the real remedy. We had given belladonna instead of stramonium. That will make you a little bit more experienced. So here Kent also further emphasizes, when the delirium is not on the patient, the appearance is of great suffering. Forehead is wrinkled with sick, pallid, haggard, and in head pains. His anxious look indicate intense suffering from some meningeal involvement. If it is of a physical origin, then we can notice that in brain there is some meningeal involvement. Okay? So any doubts regarding today's session, please come up. I will try to explain, or I will try to make you learn about the understanding. Please put forward your doubts. We have a couple of minutes and then I will make a note on the Thanksgiving part. Okay. Okay. So generally we will get no doubts. We are completely out of any doubt, etc. in two instances. One is that we had completely understood the person's presentation, the person's perspective, or the person's learning ability, learning thing, or when we didn't understand anything. So these are the two instances generally. So hope I am on the first side that you are completely understood each and every part of the presentation. So now the time had come to thank some people with regarding to this session. First, the principal of Vidhyadeep University. Thank you so much, sir. The Swara Gurukul Academy, Dr. Shekhar sir, Dr. Priyanka ma'am, Dr. Divya ma'am, and Dr. Kirubashni ma'am, who had put so much valued efforts and wants to help the homeopathic students and aspirants all over the world. Thank you so much, sir and madams. And the management of Vidhyadeep University, who had taken all the pain to arrange all these things and helping the homeopathic students. So great regards to all of those people. I don't know their names, etc. And finally, the team of Sankalpa Homeopathy Academy. So where we also do in our native language, Telugu language, to understand, to make people understand the different perspectives of homeopathy up to our standards. And in that particularly Dr. Gautam, who had helped me in many ways, collecting all the data, typing, doing the PPTs, spending time with me, how to do it for this early homeopaths rather than above teaching above standards, etc. All these were well planned in a very good way by Dr. Gautam. I sincerely pay my regards to all of these people. Thank you. Thank you so much. Thank you so much, all of you.
Thank
Namaste.
you, sir, giving knowledge what to observe in sick and how to apply Materia medica. Thank you. Such a nice, sir, today. Thank you, sir.
Okay, okay. Thank you, ma'am. So I think we had concluded the session. So can I leave the session, ma'am?
Yes, yes.
Yeah. Thank you so much, ma'am. Thank you so much.
Thank you.